15 signs that you will die early and how to reverse it. Have you ever wondered if the tiredness you feel every day, for no apparent reason, could be a warning that something serious is happening in your body? Or if that unexplained loss of appetite could be a sign that your health is asking for help? And when shortness of breath appears for no reason, do you know what your body is trying to say? Today, we're going to uncover 15 critical signals your body sends when it's overworked, and more importantly, how you can reverse these signals and regain your health. Are these symptoms just stress, or could they indicate something more serious? Imagine if you could understand these alerts and know how to act before the problem worsens. What would your life be like if, instead of ignoring these symptoms, you saw them as a call to deeper care? Follow until the end to find out what to do if any of these signs are present in your daily life. And pay attention to sign 10, as it is very serious and has already killed many people. Let's get started. 15 signs that you're almost dying and how to reverse it. Sign 1. Extreme tiredness for no apparent reason. Feeling tired after a long day is normal, but what about when tiredness becomes part of your routine, even for no apparent reason? This is one of the most common signs the body gives to show that something is out of balance. Constant exhaustion can be the body's way of warning you about underlying health problems, such as anemia, hormonal disorders, or even nutritional deficiencies. Extreme tiredness, when accompanied by other symptoms such as shortness of breath or difficulty concentrating, may indicate that the body is overworked. Factors such as lack of sleep, poor diet, and high levels of stress can also contribute to this feeling of exhaustion. If you feel tired for no apparent reason, it may be time to investigate further. To reverse this fatigue, it is essential to adopt some routine changes. Invest in a diet rich in vitamins and minerals, such as iron and vitamin B2, which help maintain energy levels. In addition, establish a regular bedtime, as quality sleep is vital for the body to recover its energy and function well during the day. If fatigue persists, see a doctor to carry out tests and rule out more serious problems. Diagnoses such as chronic fatigue syndrome or hypothyroidism require specialized attention. By acting preventatively and prioritizing your rest, you will be taking an important step towards rebalancing your body and increasing your quality of life. Sign 2. Loss of appetite without explanation. Feeling like you've lost interest in foods, even those you used to like, can be a warning from your body. Loss of appetite, especially when not associated with a change in lifestyle or diet, can indicate problems such as anxiety, depression, or even gastrointestinal illnesses. Our appetite is linked to many internal processes, and its reduction can be a warning that something is affecting these systems. This sign becomes even more worrying if it is accompanied by rapid weight loss or a constant feeling of weakness. Lack of appetite can be triggered by emotional factors or even deficiencies in essential nutrients, such as B vitamins and zinc. If you notice that your food intake is becoming increasingly scarce for no apparent reason, this may indicate that your body is under stress. To reverse loss of appetite, it is important to first try to identify the cause. Eating small meals throughout the day and including nutrient-dense foods can help stimulate your appetite. Foods like fruits, nuts, and lean proteins are light and nutritious, helping the body regain balance without straining the digestive system. If the condition persists, seek medical help to investigate possible underlying causes, such as hormonal or intestinal problems. Health professionals may recommend specific supplements or treatments to stimulate your appetite in a healthy way. Recovering your appetite is essential to ensure that your body receives the energy and nutrients it needs to stay strong and resilient. Sign 3. Unexpected lack of air. Feeling short of breath for no apparent reason can be a warning sign. If you notice that simple activities, such as climbing stairs or even walking slowly, begin to cause difficulty breathing, this could indicate respiratory, heart problems, or even anxiety. Frequent shortness of breath should not be ignored, as it can be a warning that the body is struggling to get enough oxygen. This symptom, when it appears suddenly or constantly, can be triggered by conditions such as anemia, heart failure, or lung disease. Furthermore, stress and anxiety can cause shorter breaths and make it difficult for the body to exchange oxygen properly. Identifying whether this shortness of breath is sporadic or constant can help understand the severity of the problem. To help reverse this symptom, try adopting practices that help regulate your breathing, such as diaphragmatic breathing and light stretching exercises. Managing stress is also key, so consider techniques like meditation and yoga, which can calm the mind and improve breathing capacity. If shortness of breath persists, it is crucial to seek medical advice to rule out more serious problems. Specific tests can identify possible heart or respiratory problems. Sign 4. Chest pain. Chest pain is one of the most serious signs and can be associated with heart problems, such as angina or even signs of a heart attack. Although some chest pain can be caused by muscle tension or acid reflux, it is essential to pay attention to the type of pain and its frequency. This type of pain should never be ignored, especially if it appears suddenly or is accompanied by shortness of breath and excessive sweating. Pain that radiates to the left arm, jaw, or shoulder can be a sign that the heart is under stress and needs immediate attention. This symptom, often related to circulation problems or excessive exertion, may indicate that the body is having difficulty maintaining normal blood flow. Factors such as stress and a sedentary lifestyle can also aggravate this condition. To reverse or alleviate occasional chest pain, staying active and engaging in moderate exercise can help. Strengthening the cardiovascular system with light aerobic activities, such as walking and stretching, contributes to heart health. Furthermore, controlling stress and anxiety can be a great ally, as these factors also directly influence heart health. However, recurring or very severe chest pain should be evaluated by a doctor as soon as possible. Tests such as electrocardiograms and echocardiograms help identify possible problems and prevent complications. Taking care of the heart is essential, as it is the engine of our body, and taking care of it means a better quality of life. Sign 5. Mental confusion and lack of concentration. We all experience moments of distraction, but constant mental confusion and lack of concentration can be signs of something more serious. When simple tasks become difficult, or you start forgetting things frequently, your body may be warning you of problems such as lack of sleep, excessive stress, or even nutritional deficiencies. A clouded mind can be a direct reflection of unbalanced physical and mental health. This type of confusion and difficulty concentrating can also be associated with conditions such as depression, anxiety, and even hormonal imbalances. When the mind is overloaded or the brain does not receive adequate nutrients, it is common to experience this type of disorientation. If this happens frequently, it is a sign that the body is asking for special care. To reverse this mental state, it is essential to adopt practices that help the brain rest and nourish itself. A diet rich in omega-3s, present in foods such as fish and flax seeds, can improve brain function. Additionally, breathing and meditation techniques help calm the mind, while regular breaks during work help with concentration and prevent mental fatigue. If episodes of mental confusion continue, it is worth consulting a professional. In some cases, vitamin supplementation or a change in daily habits can make all the difference. Remember, taking care of your mind is just as important as taking care of your body, and by prioritizing your mental health, you guarantee a more balanced and productive life. Sign 6. Rapid and unexplained weight loss. Losing weight effortlessly may seem positive, but sudden weight loss can signal health problems. If you notice significant weight loss without changes in diet or exercise, your body may be signaling disorders such as thyroid problems, diabetes, or infections. In addition to physical causes, psychological factors such as stress and anxiety also contribute to involuntary weight loss, as the body, under stress, uses more energy and appetite may decrease. To reverse this situation, a balanced diet is essential. Foods rich in protein, such as lean meats, eggs, and legumes, help maintain lean mass. Reducing stress with physical activity and relaxation techniques can also stabilize weight, If the loss persists, it is important to see a doctor. Blood tests and thyroid function tests can identify imbalances. Regaining adequate weight ensures that the body is strong and well-nourished for everyday life. Sign 7. Dizziness and vertigo. Feeling dizzy occasionally can happen, but when it becomes frequent, it's important to pay attention. Constant dizziness and vertigo are warning signs that the body emits when something is not balanced, which may indicate problems such as low blood pressure, anemia, dehydration, or even neurological issues. This symptom is especially concerning if it occurs for no clear reason, such as rapid changes in position. Vertigo, which is the sensation that everything around you is spinning, may be linked to problems with the inner ear, which is responsible for our balance. Additionally, conditions such as unregulated blood sugar levels and excessive stress can also trigger episodes of dizziness. Feeling dizzy frequently or in unexpected situations is a sign that your body needs attention. To try to control these episodes, it is important to keep the body well hydrated and ensure a balanced diet to avoid sudden drops in blood pressure or blood sugar. Another tip is to avoid sudden movements when getting up and look for exercises that strengthen balance, such as yoga. These simple measures can help reduce the frequency of dizziness. However, if dizziness or vertigo persists, it is essential to see a doctor. Tests such as blood glucose testing and hearing exams can help identify possible causes and determine appropriate treatment. Dealing with these symptoms preventively is essential to avoid accidents and ensure a life without limitations. Sign 8. Intense and frequent headaches. Headaches are common, but when they are intense, persistent, or frequent, they can be an indication that something is wrong. This type of pain, especially if severe and disabling, can be a symptom of problems such as migraines, hormonal disorders, or even high blood pressure. It is important to differentiate temporary headaches from those that occur with abnormal frequency or intensity. The causes can vary, from dehydration, stress, and lack of sleep to more serious neurological problems. Frequent headaches can also be caused by muscle tension, especially for those who spend a lot of time in front of screens. If you experience intense headaches that are not relieved by common painkillers, your body may be asking for urgent attention. To try to reduce this pain, it is important to stay hydrated, stretch regularly, and avoid postures that put stress on the neck and shoulders. Another tip is to practice relaxation techniques such as deep breathing, which helps relieve stress. Avoiding stimulants such as caffeine and excess sugar can also help reduce the occurrence of these pains. If headaches persist, seek medical advice for a more accurate diagnosis. In some cases, tests such as MRI or CT are necessary to investigate possible causes. Taking care of this symptom is essential to ensure that it does not interfere with your quality of life and well-being. Sign 9. Frequent heart palpitations. Feeling your heart race or beat irregularly from time to time can be normal, especially in situations of stress or physical exertion. But when heart palpitations happen for no apparent reason, and frequently, it could be a sign of heart problems, such as arrhythmias, or even imbalances in the levels of electrolytes, such as potassium and magnesium, in the body. Palpitations can also be caused by too much caffeine, alcohol consumption, lack of sleep, or anxiety. If these episodes occur constantly and without a clear reason, it is important to pay attention, as they indicate that the heart is having difficulty maintaining a regular rhythm. This symptom, when ignored, can lead to more serious heart problems. To control palpitations, it is recommended to reduce caffeine consumption and avoid energy drinks. Maintaining a healthy sleep routine and practicing relaxation exercises also helps reduce stress on the heart. Foods rich in potassium, such as bananas and avocados, can help balance electrolytes and reduce palpitations. If palpitations persist, consult a cardiologist for tests such as an electrocardiogram or echocardiogram. These evaluations allow you to check whether there are heart problems that need treatment. Taking care of your heart health is essential for a balanced life and to avoid greater risks in the future. Sign 10. Tingling and numbness in hands and feet. Feeling occasional tingling or numbness may be normal, especially after being in an uncomfortable position for a long time. However, when this sensation occurs frequently or for no apparent reason, it may indicate problems such as nerve compression, poor circulation, or even conditions such as neuropathy, which is damage to the nerves. This symptom may be a sign of vitamin deficiencies, especially vitamin B2, which is essential for nerve health. Additionally, conditions such as diabetes and multiple sclerosis can cause these symptoms. If the tingling and numbness are persistent or intense, it is important to investigate the cause, as this could indicate something more serious. To relieve tingling and numbness, try to move regularly and avoid postures that compress nerves or limit circulation. A diet rich in vitamins, especially B vitamins, can help with nerve health. Taking breaks to stretch, especially for those who work sitting, is also a beneficial practice. If symptoms continue, seek medical evaluation for blood tests and nerve function tests. Early diagnosis helps prevent worsening of neurological conditions and ensures treatment is more effective. Maintaining nerve health is essential for an active life without limitations. Sign 11. Insomnia and constant problems sleeping. Occasional insomnia is common, but when it becomes frequent, it can indicate serious problems. Sleep is essential for the regeneration of the body and mind, and its absence can be associated with conditions such as anxiety, depression, or hormonal imbalances, affecting health and increasing the risk of disease. In addition to emotional causes, conditions such as sleep apnea and restless leg syndrome also make it difficult to sleep. Factors such as using electronics before bed, consuming caffeine at night, and irregular sleeping habits aggravate the problem. If you take a long time to fall asleep or wake up several times, it's a warning sign. To improve sleep, it is important to establish a regular schedule, avoid electronic devices before bed, and practice relaxation techniques such as meditation. Reducing caffeine and creating a dark, quiet environment also help. If insomnia persists, it is recommended to seek a specialist to identify specific causes and treatments. Routine adjustments or targeted treatment can restore healthy sleep, essential for physical, mental, and emotional health. Sign 12. Frequent digestive problems. Occasional digestive issues such as stomach pain, bloating, and indigestion are normal, but if they persist, they can signal more serious conditions such as food intolerance, irritable bowel syndrome, ulcers, or gastroesophageal reflux. Emotional factors such as stress and anxiety also directly influence the digestive system, causing discomfort, heartburn, and even diarrhea, especially after meals. To alleviate these problems, it is recommended to avoid fatty foods, carbonated drinks, and fried foods, which irritate the stomach. Eating slowly and chewing your food well facilitates digestion, while drinking plenty of water and consuming fiber contributes to good digestive function. If symptoms persist, it is important to seek medical advice. Tests, such as endoscopy or ultrasound, can identify underlying causes. Maintaining digestive health is essential for well-being, as the digestive system is responsible for absorbing vital nutrients, ensuring energy and disposition for everyday life. Sign 13. Muscle and joint pain for no clear reason. Feeling pain in your muscles and joints after physical exertion is normal, but when these pains appear for no apparent reason and become frequent, it can be a warning. Unexplained joint and muscle pain may indicate problems such as arthritis, fibromyalgia, or even nutritional deficiencies. This symptom is the body's request for attention, especially if it appears without you having performed intense activities. Furthermore, accumulated stress and tension can also manifest through physical pain. When the body is constantly tense, it puts stress on the muscles and joints, causing pain. It is important to observe whether the pain always appears in stressful situations or whether it is accompanied by other symptoms, such as extreme tiredness and insomnia. To alleviate muscle and joint pain, a good practice is to include stretching and light exercise in your routine, such as walking or yoga, which help relax the body and reduce tension. Staying hydrated and consuming foods rich in magnesium and calcium, such as green vegetables and dairy products, is also important for muscle and joint health. If pain continues, see a rheumatologist or physical therapist for an evaluation. Blood tests and mobility tests can help identify underlying causes and direct treatment. Not ignoring these pains is essential to prevent future problems and ensure that the body remains healthy and active. Sign 14. Visual changes and sensitivity to light. Changes in vision, such as blurriness, double vision, or extreme sensitivity to light, should be taken seriously. These symptoms can indicate eye problems, such as cataracts and glaucoma, or even neurological conditions, such as migraines and brain issues. Vision is essential, and sudden changes should be seen as warning signs. These symptoms can also be caused by eye strain, common in people who spend a lot of time in front of screens, vitamin A deficiency, or diseases such as diabetes. If you notice excessive blinking or eye pain when exposed to light, it is important to take note. To protect your vision, it is recommended to take breaks when using electronic devices, wear glasses with a UV filter, and consume foods rich in vitamin A, such as carrots and sweet potatoes, which support eye health. Keeping your eyes lubricated with recommended eye drops can also help. If symptoms persist, it is essential to consult an ophthalmologist. Exams, such as fundus examinations, can reveal hidden problems and ensure appropriate treatment. Preserving eye health is essential to maintaining quality of life. Sign 15. Skin changes, such as paleness or unusual spots. The skin is the largest organ in the body and often reflects the state of our internal health. Changes in color, such as paleness or the appearance of spots, can be signs of deeper problems, such as anemia, liver problems, or even hormonal imbalances. When the skin shows significant changes, it is important to pay attention, as the body may be trying to warn you that something is wrong. Paleness, for example, may indicate a lack of iron in the body, while yellowish spots may be related to liver problems. Additionally, dark spots or bruises that appear for no apparent reason may signal problems with blood clotting. The skin reflects what is happening inside, and any unusual and persistent changes should be taken seriously. To take care of your skin, it is important to adopt a diet rich in vitamins and minerals, especially vitamin C and iron, which are essential for healthy skin. Staying hydrated and using sunscreen daily are also essential practices to protect the skin from external damage. Avoiding excessive use of chemical products and moisturizing regularly also help maintain its balance. If skin changes persist or worsen, consult a dermatologist or general practitioner. Blood tests can identify deficiencies or internal problems that are affecting the skin. Taking care of skin health means taking care of the health of the body as a whole, ensuring more vitality and well-being. The importance of consulting a doctor. Although many symptoms seem harmless at first glance, they can hide health problems that require specialized attention. Seeing a doctor is essential to understand what is really happening to the body and receive an accurate diagnosis. Health professionals have the necessary knowledge to identify the causes and recommend appropriate treatments, preventing symptoms from worsening. Many people tend to postpone a doctor's appointment due to fear or even lack of time, but ignoring signals that the body gives can be risky. Health problems, when identified early, have greater chances of treatment and cure. A simple assessment can help rule out serious problems or begin treatment before the condition worsens. Furthermore, medical monitoring helps to prevent future illnesses and maintain an appropriate care routine for each stage of life. Periodic exams allow you to monitor your health and make adjustments as needed. Many conditions can be controlled with changes in habits and specific care, which only a professional can fully guide. Investing in health is essential to live well and with quality. Don't wait for symptoms to become unbearable to seek help. Prevention is always the best way, and seeing a doctor regularly is the first step to ensuring well-being and longevity. Remember, taking care of your health is a priority that should not be left for later. General prevention. Preventing health problems is much easier than treating them once they appear. Adopting healthy lifestyle habits is one of the best ways to prevent warning signs from appearing. A balanced diet, quality sleep, and physical activity are three fundamental pillars to ensure that the body functions well and is more resistant to disease. Furthermore, taking care of your mental health is essential to maintain balance in your body and mind. Practices such as meditation, leisure time, and activities that help relieve stress are excellent for preventing it from affecting physical health. Daily self-care, including taking breaks from work and time to rest, is essential for a long, healthy life. Carrying out periodic exams is another important step in prevention. Annual checkups and routine exams can identify deficiencies and problems before they become serious. This attitude allows you to take early action to protect your health and avoid major complications. Do not neglect the importance of staying informed about your health status. Finally, staying hydrated and avoiding excesses, such as alcohol and tobacco consumption, also contributes to more balanced health. Small changes in everyday life, when practiced regularly, bring great benefits in the long term. Prevention is always better than cure, and these simple habits are the path to a fulfilling life without limitations. If you've made it this far, you've already taken a big step towards understanding your body's signals and taking better care of your health. Now don't forget, activate the bell and subscribe to the channel so you don't miss any new content. Leave a like and share this video with those you love so that everyone can recognize these signs and protect themselves.